If you have ever had joint or tendon pain, chances are you have been offered a steroid injection. They are quick, they are covered by insurance, and they provide relief. But what if I told you that these injections could be doing more harm than good? I am Dr. Sunil Arora, and today we are going to discuss 5 major downsides of steroid injections, including how they can damage your joints, weaken your tendons, and negatively affect your overall health. We will also talk about safer, more effective alternatives like platelet-rich plasma and why investing in your health now could save you from long-term complications. Here is downside number 1. Steroids suppress inflammation, which is why they reduce pain so quickly. But inflammation is also an essential part of your immune system. Studies show that corticosteroids can reduce your body's ability to fight infections by suppressing white blood cell activity. A level 1 study published in JAMA found that even a short course of oral steroids increases the risk of serious infections like pneumonia and sepsis. Now imagine the effects of repeated steroids over time. You may be getting pain relief, but at what cost to your overall health? Coming in at number 2 is the negative effect of steroids can have on your blood sugar. If you have diabetes, you may have noticed that your blood sugar skyrockets after a steroid injection. That's because steroids reduce insulin sensitivity, making it harder for your blood to control blood sugar. In fact, one level study in the Lancet found that repeated steroid use increases the risk of developing type 2 diabetes. Number 3, do you have high blood pressure? Steroids can make it worse by causing fluid retention and increased sodium levels, putting more strain on your heart. This is exactly why many doctors usually are reluctant to give steroids to patients with diabetes and hypertension. But in reality, these effects happen in everyone, not just those with pre-existing conditions. Number 4, tendons are strong, flexible structures that connect muscles to the bone. But research has shown that steroids can directly damage tendons, making them weaker and more likely to rupture. A level 1 study in American Journal of Sports Medicine found that after a steroid injection, tendons undergo degeneration and lose their ability to repair themselves. That means that while steroids may reduce pain in the short term, they actually make tendon injuries worse over time. This is why steroid injections are never recommended for conditions like tennis elbow or Achilles tendonitis because they increase the risk of complete tendon rupture. And here is reason number 5. If you have osteoarthritis, you might have been told that steroids can help with pain and swelling. But what if they are actually making your arthritis worse? Multiple level 1 studies, including one in the journal JAMA, have shown that repeated steroid injections lead to faster cartilage breakdown in the knee and hip. Cartilage is what cushions your joints, and once it is gone, it is gone. So while steroid shot may provide relief for a few months, it could be speeding up the process that leads to joint replacement surgery. Oh yes, I forgot. Here is the 6th reason. One of the biggest problems with steroid is escalation, meaning that the first shot works well, but the effects wear off faster. This leads to a cycle of repeated steroid use each time, increasing the risk of systemic side effects and further joint damage. A level 1 study in the BMJ found that patients who received repeated steroid injections for knee arthritis actually had worse pain and function after 2 years compared to those who did not get steroids at all. This is why American Academy of Orthopedic Surgeons recommends limiting steroid injections to no more than 3 per year. But even that may be too much if your goal is long-term joint health. So if steroids are so bad for you, what is the alternative? Platelet-rich plasma. It is natural, non-destructive treatment that uses your own blood's healing factors to reduce pain, improve function, and even slow disease progression. Unlike steroids, PRP does not damage cartilage, tendons, or suppress your immune system. Instead, it helps your body heal by promoting regeneration rather than masking symptoms. Now, I know one of the biggest concern about PRP is that insurance does not cover it. But when you look at the long-term costs, multiple steroid injections, increased risk of surgery, and complications like diabetes or tendon rupture, it becomes clear that paying for PRP as an investment in your long-term health. Would you rather pay for something that temporarily numbs the pain while causing long-term damage, or invest in a treatment that actually helps your body heal? If you are interested in learning more about PRP and other regenerative treatments that can help you heal safely and naturally, give us a call or visit our website. Your health is worth the investment. Let's start healing the right way.